Today we have case to discuss. A 10-year-old girl is brought to the physician because of the severe throbbing headache for 1 hour. The headache is located in the right frontotemporal region. It is the fifth such headache in the past 2 months. Her mother say that's all the previous episode started after the soccer practice, following which of the child locked herself her room, closed the curtain and sleep for a few hours. After waking up, the headache is either diminished or has stopped entirely. 1 month ago, the child was diagnosed with myopic vision and has been wearing glasses since. Her 4-year-old brother had herpetic gingivitis 2 months ago. Her vital signs are within normal limit. Fundoscopic examination is inconclusive because the child is uncooperative. The remainder of examination show no abnormalities. Which of the following is the most appropriate next step management? The child presents with the history of the recurrent and unilateral headache episode, which is same to provoked by the physical activity and spontaneously resolving with the sleep. The headache appears to be assisted with the increase sensitive to the light, the absence of the fever, loss of conscious, neurological defect, or neck stiffness make migraine the most likely diagnosis in this patient. Neurooptometric assessment. The patient had myopia, where she was recently evaluated and has been wearing correct lenses. Refractory error should not be contributed to her symptoms. In the child's lumbar puncture, the patient chronic episode symptoms that are relieved by sleep subject of migraine, for which lumbar puncture is not diagnosed. The acetaminophen is the correct answer because the NSAID or acetaminophen are the first line operative treatment for children with migraine. This therapy are generally safe and effective for children and have minimal side effect. Operative therapy should be admitted immediately as it is most effective when taken at the onset of the migraine. If the first agent, acetaminophen, fails to relieve the symptoms, the other agent like NSAID may have been given. The headache calendar should be also recommended to treatment for environmental trigger of headache like exercise, stress, and certain food like chocolate. The dihydroglutamine therapy is the last resort to abortive medicine for severe migraine. In MRI of the brain, neuroimaging is indicated for children have headache and there is a spontaneously or suspicion of the increasing intracranial pressure or intracranial lesion that have another symptoms in the history like a seizure, recent head trauma, or abnormal neurological examination. Amitriptyline therapy. Amitriptyline is indicated for the migraine prophylaxis, which is used in abortive medication have failed or the migraine are very frequent or prolonged. Before intense prophylaxis, the patient's lifestyle modification and abortive medication should be admitted. Thank you for everyone for listening.